My name is JC Williams. I am a part of the South Carolina Schools Network, which aims to identify and promote healthy eating and active living strategies in South Carolina public schools that empower key stakeholders and encourage collaboration among those seeking to improve student health and academic achievement.
Thank you, JC. And my name is Erica Ayers. I'm the Executive Director for the South Carolina Governor's Council on Physical Fitness. And the mission of the council is to support the health of all South Carolinians through the advancement of physical activity and physical fitness. And one of the priorities for the council is to support the health and well-being of students, which is why we work alongside with the Schools Network. An example of this collaboration between the council and the Schools Network is this webinar series. The purpose in this webinar series is to connect schools and communities using the whole school, whole community, whole child model as a framework to support student health. And today with our webinar, our panelists are going to be touching on these topics: physical education and physical activity, physical environment, and community involvement. And even though it's not listed here, but what's even more important and what we'll be learning about today is youth engagement. So definitely looking forward to that. Lacey will go ahead and introduce our panelists, and then I will stop sharing so that they can share.
All right. Thank you to everyone who answered our poll. We've got a large variety of people with us this morning. Love that. During today's presentation, we will learn from Brandie Freeman, Wholespire's Marketing and Communication Manager, and Jamaius White, the HYPE Project Program Manager, as they discussed community and school projects that shape the physical environment. This webinar will explore advocacy efforts surrounding schools, the Healthy Young People Empowerment Project, and funding opportunities for PSE change. We will turn it over to our outstanding presenters.
Thank you, JC. And thank you all for being with us this morning. We are very happy to be here to talk about Wholespire and how our work impacts the whole community, the whole school, and the whole child. Before we begin, I'd like to know how many of you have heard about Wholespire. We'll give you a few seconds to answer this poll. Great, that's wonderful. 61% of you have heard about Wholespire and 39% have not, and that is quite all right. For those of you who've never heard of us, you may have heard of Eat Smart, Move More, South Carolina. That is us. That's Wholespire. We rebranded a few years ago to better represent the work and the reach that we do. And if that doesn't ring a bell for anyone, that's quite all right. Wholespire is a private public health nonprofit. We work with community coalitions, state agencies, and other nonprofit organizations to reduce the instances of chronic disease by focusing on the lack of healthy choices in our communities. Locally, we help coalitions identify barriers that keep residents and visitors of all ages from succeeding at chronic disease prevention and management. This means improving essential community resources that provide opportunities to be active and to choose nutritious foods. At Wholespire, we value knowledge and best practices, and we want our communities to do the same. We want them to know the issue and advocate for improvements. We want everyone to have a fair chance at making healthy choices. When essential community resources like parks, playgrounds, farmers markets that accept SNAP, and sidewalks cannot be accessed or used by everyone, then the likelihood of them learning and adopting healthy behaviors is low. That's why we focus on supporting sustainable change. Sustainable change gives everyone in the community a chance to lead healthier lives. When we say sustainable changes, we mean creating or improving community resources that can lead that can be used over an extended period of time. Our approach is called policy, systems, and environmental change. And throughout the presentation, you'll hear me refer to it as PSE change. By changing policies and shaping physical landscapes, a significant impact can be made with little time and resources. PSE is very different from programmatic change. When we think of programs, we think about education classes or cooking classes that can be used to help individuals with a chronic disease or a desire to make healthier choices, adopt a healthier lifestyle. This is individual behavior change. We do not focus on individual behavior change, but what we do focus on leads to individual behavior change. PSE gives those people and everyone else opportunities to be more active and to buy locally grown and fresh produce. This is often referred to as population-based health. PSE change is more sustainable than programs because it focuses on modifying the environment to make healthy choices practical and available to all community members. All right, so we're gonna delve into the meat of our work here. Advocacy, it's a large focus at Wholespire. We are one of the few public health nonprofits that can lobby and advocate. We advocate to decision makers on all levels to include health in all policies. We also encourage the communities we work with to advocate for PSE change within their town, school, neighborhood, church, and other places where change can be beneficial to large pockets of the population. A majority of our advocacy work is directed towards our state legislators. Changing and creating policies to include health reaches entire segments of the population. Here are some of the most current bills that we're advocating for at the State House right now. Senate Bill 148 and its companion bill, House Bill 5022, address healthy school meals for all public school students. They ensure that all schools participate in the USDA's community eligibility program. And it actually extends the lunch period to give students and teachers a little bit longer to eat their meals. With these bills, all students get at least 2 nutritious meals every school day at no cost. H 4655 ensures that the recommended amount of physical activity and quality physical education are provided to all students in grades 4K through 8. The Healthy School Meals for All bill is being adopted as a proviso, and it's currently included in the Senate's version of the state budget, and that's a good thing. I don't have any updates on the status of the physical education and physical activity in schools bill at this time, but our legislators have other priorities right now. They're working on their budgets. It's an election year, so there hasn't been a lot of movement with H 4655. But if you're interested in learning more about these bills, you can use the link in the chat or the QR code on the screen, and you can visit our advocacy center. We also do non-legislative advocacy. There are times when we advocate to state agencies and state level organizations. And on the screen, you'll see a wonderful example of that. In 2014, we partnered with the Alliance of YMCAs to advocate for a state level open community use policy. Together, we were successful at encouraging the South Carolina School Boards Association to adopt the model policy KFA, open community use of school recreational areas. This policy allows community members to use outdoor playgrounds, green spaces, walking tracks, basketball courts, and other outdoor resources for safe and affordable outdoor physical activity after school hours or when the school district or school specifies. Once the policy was adopted, we advocated to school districts across the state to adopt the policy, and almost all of the school districts adopted it. JC's going to put a link in the chat if you're interested in reviewing the policy. We were very excited that this passed and that many schools adopted it. If your school has not adopted an open community use policy, we highly recommend advocating to your school district for that. And I'll touch on this again later on. In the past, we've advocated to schools to create wellness committees and include health and policy. Here are some examples of school-based policies that we've supported in the past. We continue to do so today. Healthy fundraising policies. You know, it's really easy to raise funds by selling donuts or candy bars. It's the only choice the buyer has. And who doesn't want to support a child selling these things? But what if you tried selling something healthy or not selling food at all? What about fruit, like many high school bands do, or fun runs? You could even have a silent auction. There are tons of alternatives. Those are just ideas, but Action for Healthy Kids is a national organization. They have some pretty neat ideas on their website. You can check out the link in the chat. You can also head over to our website at Options for Action, and that link will be put up shortly. Another example, a healthy celebrations policy discourages parents and teachers from providing cupcakes and sweets during classroom celebrations, while a healthy rewards policy encourages teachers to provide non-food or healthy food items as incentives in the classroom. You can use the link in the chat to learn about this example of healthy rewards in schools that you see here on the screen. The picture shows a book vending machine at Batesburg-Leesville Middle School. Teachers use this as an incentive or reward for student achievements. The South Carolina School for the Deaf and Blind in Spartanburg has one of these too, and they're pretty impressive. I've seen that one, and it's a really cool and neat and educational way to celebrate student accomplishments. Healthy vending and healthy concessions policies are good for making healthy choices available. You often find unhealthy foods and snacks and beverages here. Why not adopt a policy stating that a percentage of the food choices will be healthy? You might be surprised by the number of people who choose a healthy item. We worked with Richland, Spartanburg, and Charleston County governments. This, of course, is not school-based, but it can be implemented in a school environment. So we worked with these governments on adopting and implementing a healthy vending policy, and now they did it, and now any county employee or visitor to the government building has access to healthy choices in their vending machines. And just keep in mind that this is not pushing healthy choices on people. It's giving them the choice. It's providing the choice. So I have already mentioned Options for Action on our website, but you can use the link in the chat to access Options for Action. It is a searchable database of resources related to PSE change, and you can filter it out by school, and you'll see everything on there related to schools. It's a really good starting point for brainstorming and finding funding sources. Wholespire has a network of grassroots advocates who we rely on through legislative sessions for help with reaching key state legislators. We also rely on them for our non-legislative advocacy efforts. If you want to get involved and advocate for healthy eating and active living, I highly encourage you to become a Wholespire advocate. You can use the link in the chat or the QR code to access the online form. We make advocating very easy. We give you the messaging, and all you have to do is compose an email or pick up the phone and read a script. I mean, it's super easy. So please become an advocate. All right, so at this time, I'm turning it over to Jamaius White, our program manager of the Height Project.
All right, thank you, Brandie. I've learned a few things myself. Wholespire is obviously a great place to be. Brandie, can you go to the next slide for me? All right, so as stated, I am the program manager for the Height Project. And it's what I like to call the mini version of Wholespire. Brandie, if you'll go to the next slide. So the famous question that I often get, what is the Height Project? So the Height Project is a 5-part curriculum that aligns with the National Health Education Standards. The contents within the advisor guide and the youth guide are supported through an evaluation that was conducted by the Honor School of Public Health at USC. And with this information that's within the guides, it basically teaches the youth how to carry out some of these options for actions that Brandie mentioned in their own right. So it pretty much teaches them how to be an advocate for those things that they care about. Next slide, Brandie. So the Hype Project, the design of the Hype Project is specifically for our communities, and it doesn't just limit it to that word community. It includes our schools, any public areas of play, any neighborhoods, any churches, and any places that the youth occupy on a frequent basis. And then so like, for example, like that, some of the activities that we have in the guide are intended to help our youth develop a lot of their individual skills, like their social skills, their critical thinking skills, their researching ability, and learning how to develop projects, both on the individual level and in a group setting. Next slide, Brandie. So the Hype Project is comprised of 5 different phases. These 5 phases all serve a very strategic purpose. Like the first 2 phases that we have listed here, think and learn. These 2 are where the youth actually go within. JC, do I need to stop and address that, or we're good
You
to
are
go?
good to go.
Okay, perfect. So, so with these 2 phases that we have listed here, think phase is basically where we're talking about development of their critical thinking skills, bringing, the identity and open up what PSC is, which Brandie went over briefly earlier. So the youth will learn, at the policy change, they'll learn how the laws, regulations, and rules can be changed or lobbied for or against in the improvement of their quality of life and play or usage. At the system changes, it's pretty much, the process of how those same things can be, lobbied for or against in the, scope of having a healthier quality of life. And in environmental change, that's basically, obviously, the physical areas that they frequent, in our space. So, make sure that they have safe places to, walk to school, safe places to play. And we do all of these things, by going through what we call a socio-ecological perspective, which allows the youth to not only think on that individual scale, but they think on those larger scales where we're talking, the community. How does that affect that? How does the neighborhood impact that? How does policy and the decision-making impact, their individual lives? And, pretty much how does that promote a healthier eating and active living type of lifestyle for the youth and their peers? Next slide. So the ACT phase, which is my favorite, I call this the meat and potatoes of the phases, where a majority of the work is done. The ACT phase is where the youth actually learn how to create budgets, learn how to create, how to identify their problem focus area. They learn ways to gather the best way to gather information for their problem. They learn how to sort out the things that they've concerned. So with 5 youth in a group, they, pretty much talk it out and, weigh the pros and cons of addressing one of those problem focused areas first. So alongside learning how to budget, they learn how to create an action plan, right? And so with that action plan, they then go into, the actual part of implementing their project by going and speaking with the necessary community stakeholders or the necessary people within their school or the county council or the city council or whoever they identify as a person that they need to make contact with to get their idea or their problem focus area close to that solution that they've identified. Next slide. So in the share and evaluate phase, which are the final two phases of the HYPE curriculum, these two phases, one, the youth pretty much learn how to speak and present that those findings and those different projects to the community, or their target audience. So they always have to show their work. Like for teachers, show our work, that classic saying of Saul. And then going to the final phase of evaluation, or the evaluate phase, this is pretty much where the youth gauge how well the HYPE project experience was, right? So we're talking about fidelity. This is something that we as Wholespire take this information and constantly make sure that we have the best quality, material within our guides, that we're presenting the best opportunities, for our youth to become those advocates starting at an earlier age, so that they can learn how their voice is very much impactful in the larger decisions that's made on our everyday lives. So they pretty much learn how to govern, everything about us, about themselves, and how to move forward, within their spaces that they frequent. Next slide. So I know I kind of rushed through that information just now, but for more information, or more in-depth information, you all can, use this QR code, or there will be a link within the chat that you can use to find out more in-depth information about the HYPE project, who qualifies to be a host site, who qualifies to be an advisor, what demographic of youth are qualified to participate in the HYPE project. And within there, you will also find resources to contact me directly to find out more in-depth information. As far as I want to be able to share with the teachers that are on here, or anybody else that wants to see it, a sample of our curriculum, so you can see some of the intricate information that's in there, and some of the language, and the things that they'll be learning as they take this project on. And I close by saying, knowing that the examples that Brandie listed earlier, youth can be the leaders on the advocacy for that said thing. It doesn't have to come strictly from the professors or the teachers, or volunteers within the school. The youth, if they have a concern of theirs that they want to change something, their voices can be heard. And it starts by creating that conversation, right? By getting them involved and seeing what things they actually care about. And, that's some of the stuff that I'm working right now to do with our intern that we have at Wholespire, to gauge what the youth actually care about, so that we can start to, really see how those things align with the PSC changes, and, the just the overall aspect of how we can, help them, present a healthy eating and active lifestyle to themselves, their family, their community, in their said school, since they are students, both at the high school, middle, and collegiate level as well. So that concludes my portion of the HYPE project. But if you have any more questions, I will be available to answer those. Just reach out to me via the information behind that link. And yes, Brandie, I turn it back over to you.
Thank you, Jamie, that was some really great information.
Thank you.
And I will be providing examples of HYPE projects and some of the successes that some of our teams have achieved. But right now, I want to go over the last part of our focus areas. I mentioned earlier that we work with local community health coalitions to identify barriers and needs of the community, and we do that through community action. We provide technical assistance to partners and coalitions. We consider ourselves to be experts in PSE strategy, coalition development, capacity building, sustainability, connecting communities to partners and funding opportunities, advocacy, and many other areas related to our focus areas. I mean, the list is, I could go on and giving you examples of the types of technical assistance we provide, but we do this because we want our partners and our coalition specifically to be successful, and our communities to have opportunities to lead healthier lifestyles. In a nutshell, we provide specific support to a community coalition or organization with a development need or problem. A great way to improve the health of your school and your community is to connect with a local community health coalition. Here are just a few great reasons to get involved. Bringing together groups and individuals from many sectors of the community can create alliances where there was little contact before. So working together toward common goals can help people break down barriers and preconceptions and learn to trust one another. Another great reason is creating strong local partnerships. So joining a coalition gives you opportunities to diversify and strengthen local partnerships. Most coalitions are made up of partners you may never have thought would have a stake in the health of their community. But everybody has a stake in the health of their community. There's a role for everybody. Your participation is an opportunity to build the skills and capacity of local leadership to form high-functioning coalitions and improve local leaders' abilities to address local health inequities. You have knowledge and skills to share with others that could use the help. Another great reason is to pool resources. So a number of organizations and individuals together may have the resources to accomplish a task that none of them could have done alone. And so people and organizations join coalitions to do just that, to accomplish together what they cannot do alone. And I will say that, you know, we understand, we realize that teachers and administrators, you know, have a overflowing plate of responsibilities, and you may feel like you don't have enough time or energy to join a coalition. But if you can squeeze it in there, and if you really want to play a role in the health of your community and bring back to your school the knowledge and that you gain, please do so. We highly recommend it. Schools have a huge role to play in the health of their community. So back to pooling resources. You can also learn about resources like funding opportunities that are available to you just by being involved in a local health coalition. There are organizations that have given money to certain communities to help them address community health improvement and PSC change. Healthy People, Healthy Carolinas is an initiative funded by the Duke Endowment. It's managed by the South Carolina Hospital Association, and the local hospital in the selected community acts as the fiscal agent. The Community Health Coalition that is awarded the grant dictates how it is used. You can search online for the South Carolina Hospital Association to find out if your county has Healthy People, Healthy Carolinas funding and who to connect with. Another fantastic resource is Clemson Extension. They have funding for school gardens, and they're doing a fantastic job at helping schools create and sustain school gardens. If you have a school garden and need help sustaining it, or if your school wants a school garden, this opportunity is for you. Just reach out to your local Clemson Extension office for more information. And there's one more funding source available to you, and it's Wholespire. We are excited to offer Heal Healthy Eating and Active Living mini grants to communities. So we offer these mini grants of up to $6,000 each year to assist communities in creating PSC change. Schools can apply for a mini grant to fund your PSC project. Our next opportunity opens on June 3rd, and I'll tell you how to find out more information on this Heal mini grant in just a few minutes. To qualify, you must be a 501c3 nonprofit, municipality, a coalition, a school, or faith-based organization. And if you don't have 501c3 status, you only have to have a fiscal agent, a reputable fiscal agent. Proposals must be related to healthy eating or active living, and they must implement or promote or support a PSC change. You have to be ready to implement your project and complete it within 9 months of receiving funding. And you must clearly outline how the project's going to address health equity within your community. And again, you can't request more than $6,000 for your project. So a lot of applicants and grantees use this opportunity to as seed money to start a larger project. You can start, if you have a small project, we will, if it qualifies, we'll more than likely fund it. But a lot use it for seed money to start a larger project, to move a larger project along, or to complete a project. So there are many ways to use this HEAL mini grant. Okay. We funded many PSE projects across the state. We funded water bottle refill stations, playground equipment, bike racks, crosswalks, wayfinding signs, benches, trash cans. A lot of our schools, a lot of our project grantees have been schools. They address safe routes to school, playground improvements. We help communities with projects related to their trails. We've helped some communities turn trails into a story walk. And then we've also done one, I believe it was in Anderson County, turn a trail into a born learning trail. We've helped farmers markets and mobile markets get the needed SNAP processing equipment so that they could sell locally grown and fresh produce to SNAP beneficiaries. There's just a wide range of PSE projects that we funded. And we funded a lot of really good hike teams that have made huge impacts on their community. All right, so you can find out more information about the HEAL mini grant on our website using the link in the chat, or any of our social media accounts, or on our website. While you're on our website, you can sign up to get our newsletter and funding alerts. You can also scroll to the bottom of any page on our website and get linked to our social media. That's how we promote our HEAL mini grants. Following us on social media and signing up for our emails are great ways to get notified when the RFP and the application are available. I know some of you probably have some questions. We're going to get to that in a moment. But first, I really want to go over some of the meat of our community action work. So now we're going to talk about what PSE projects look like and what we fund. This is the fun part for me. Most of these examples are school-based projects, while others are community-based that can be replicated in the school environment or by a hike team. All right, so several years ago, Community Health Coalition in Barnwell County partnered with their school district on a Safe Routes to School initiative. The school needed some necessary tools to help with school traffic and student safety. And the Health Coalition there happened to have had some funding from us during a special project. And they helped the school district get what they needed. This is a PSE change. But this and other components of Safe Routes to School can be funded with a HEAL mini grant. The School for the Deaf and Blind, I've mentioned they have the book vending machines, but they applied for a Hill mini grant to fund water bottle refill stations. There was a need to provide access to safe drinking water across the school campus before and after school. So we've actually funded several projects like this in several different schools and community parks. This just isn't for school, but it can be replicated within the community too. A Heal mini grant helps complete this paved walking track project at Grassy Pond Elementary School. The students use this for physical activity. When they arrive to school early, they can walk the path, the track, but also it's available to the community after school hours. We don't fund items like cement, but we did fund a water bottle refill station that was part of this larger project. So that's a great example of moving a project along. The Health and Wellness Committee at Tennessee Salem Elementary School wanted to improve and maintain the health and wellness of their entire campus and get their community more involved in physical activity to impact the students' health outside of school. So they painted these active pathways around the school campus to offer a place for students to move their bodies in different ways. These pathways and other outdoor areas are available to the community to use, as well as their students and staff during the school day. With this project, we funded the entire thing. We funded the stencils, the paint. They had to they leveraged their mini grant by getting volunteers, staff volunteers, community volunteers to come in and help paint these pathways. So that's a pretty neat idea. All right, so this is not a physical activity project, but it's a hike project, and it was funded by a Hill mini grant. And I wanted to show this to you all. One, because we do fund projects related to healthy eating, increased access to healthy foods. But also, I wanted to give you guys an example of the impact hike can have on the students who participate in the hike project. So this they named this the Fast Break Breakfast. But it's based on a national program called Second Chance Breakfast. It's a tested and proven program that offers breakfast breaks in the morning, often after first period for older students in secondary schools. So these food carts are strategically placed throughout the school, stocked with healthy breakfast options for students, faculty, and staff to purchase just by swiping their student ID card. So we know that students arrived at school late, buses are off schedule. Some students may think it's just not cool to go into have breakfast in the cafeteria. So the food service director, at White Knoll High School, they encountered these issues. And we know that whenever you don't eat breakfast, it can totally impact your energy, your attention span, your performance in the classroom. And so the food service director at White Knoll High School was inspired by this national program and worked with a lead teacher to replicate this across their campus. They applied for a Hill mini grant to host a hike team, and the youth on this team had a huge hand in this project. The mini grant funded promotional pieces related to the breakfast program and one cart. They have multiple carts. So again, it's a example of helping with a larger project. They have experienced great success with this breakfast program. While this is, again, not a physical activity project, this project has had a huge impact on the students on the team. So one hike team member told me that because of her experience with the hike project and learning the curriculum and helping to implement this particular project, She changed her education and career path to public health. It just opened her eyes to something brand new. She saw the value in assessing her community, which is what they did. They assessed the community. They created an action plan. They implemented the action plan, and then they got to see the success of their efforts. And those are all parts of the things that helped introduce her to public health and decide to go down that path. So you'll see here in the pictures, the first picture is the actual food cart, one of the carts that they've used. The middle picture and the last picture are all related to their assessments, I believe. So what they did was they took one of the food carts to a community event. They provided, they did a taste testing. So they provided food samples to the community to get the community buy-in. So there are lots of parents, they're at a community event, and that's how they got the community buy-in and support for this particular project. This project was a collaboration between Anderson School District 4 and the United Way of Anderson County. It was part of a special project that we did with Anderson, a health coalition in Anderson County. They created and posted these signs to encourage parents to get out of their cars during the pickup wait time and spend that precious time walking. They created 5 different signs prompting did you know questions and answers. This is a great example of 2 entities with a common goal that work together and come up with a creative solution. And they reported back that they observed increased activity by the parents or guardians or the adults who were picking up the students after school. This is one of our first successful HYPE projects. Youth involved in Bridging the Gap advocacy in Lawrence County and the HYPE project wanted to improve the safety around Sanders Middle School. So they conducted a walkability assessment. They got community support, and they advocated to Lawrence County Council to make the area safer for students to walk to and from school. They presented their findings and a solution, and the council approved the warning sign. So these teens, they were very proud of their work, their accomplishments, and they celebrated it with a walk to school event. The HYPE team here in York County learned there wasn't enough play equipment at the Junior Blue Eagle Academy, which serves grades 3 through 5. They used funds to purchase play equipment and a storage unit and donated them to the school. In addition to this project, the HYPE team also looked at the track and field area, which is open to the community after school hours. They focused on cleanliness, and they used some funds to purchase doggy waste stations and coordinated with school leaders for a trash pickup schedule. These projects were funded through a special project, but again, they are examples of things that a Hill Mini grant can fund. Yet another HYPE project. Harmon Field in the city of Dillon featured old and unsafe playground equipment. So the water fountain there had no running water. The HYPE team wanted to change that. They want a new water fountain. They did not get a new water fountain, but they did get some water going. So they advocated to county council. The council was very surprised to see kids at their meeting and actually addressing them. The council approved fixing the water issue and surprised the community with several upgrades to the community playground equipment. We did not fund the playground equipment, but we did fund the funding part of the HYPE project was improving painting park benches, making it appear more welcoming. But the large part of their project was the advocacy component to get running water in the park, and it works. Yeah, but this is an example of a type of project we can fund. The playground improvements, we can totally fund that. We funded several schools around the state with mini grants for new play equipment, water bottle refill stations, open community use signs, and many other features that make the school environment healthier. All right, this is the last example, and these are examples of HEAL mini grant projects that can be replicated on school grounds and within your community. They all these examples all address basketball courts. But again, it can be replicated. So the first one was a hype project. We funded a hype project at a local AME church in Richland County, and this was a community park that had overgrown bushes. It was unwelcoming, unsafe. The basketball court could not be used. And the hype team chose to revitalize this park, this basketball court. The one in the middle is actually a HEAL mini grant that we funded a couple of years ago in Kershaw County, the Knights Hill Neighborhood Park. The basketball court surface was cracked, and I think the basketball goals were just old and unusable. So they received funding to make all of these improvements you see here. They filled in the cracks on the surface. It was a lot of hard work, a lot of volunteer hours. They worked with the county recreation to get a lot of the trees and the brush cleaned up in that area. And now they see increased activity at the basketball court. The last picture is a basketball court that we funded in Spartanburg County for Go Forth Recovery. This is a drug and alcohol abuse recovery house. They had a need for an outlet for residents and their families when they visit, and we didn't fund the entire project, but we did fund some of the project here. So I hope these projects have sparked some thinking, some brainstorming, some ideas. So again, our next application for the HEAL mini grant opens on June 3rd. I encourage you to sign up for our newsletter and follow us on social media so that you can be notified. I want to thank you for spending your morning with us. If you have any questions after this webinar concludes, you can email me or Jameius, and we'll be happy to provide you with the information that you need.
That was a great job, Brandie.
Thank you. Do we have any questions that need to be answered?
Thank y'all again for an amazing presentation. It's great to see the work that's going on throughout South Carolina. We do have a question for schools participating in a school-based wellness initiative. It's not a question, but it is a statement. Most of these projects earn lots of points, and that is very true. I know at the Alliance for a Healthier Generation, they have their big point-based system, and this goes towards that. And if you're in the Low Country with MUSC, then those points would be great there as well. We'll give it another minute or so for any other questions. And in the meantime, we will switch our screens to let Erica share about our upcoming webinar.
Thank you, JC. All right, let me find my share button because it always hides. First off, I just want to give a big thank you to Brandie and Jameius today for sharing the amazing things going on through Wholespire. I didn't mention it earlier, but most of y'all know who I am by now if you've been coming to several of these. And I also work for DHEC's Division of Nutrition, Physical Activity, and Obesity Prevention. And we've been working with Wholespire since their inception when they were East Martin, South Carolina. And it's been a really amazing partnership for the last several years now, even before I got involved with DHEC. And I had a smile on my face every time you showed the pictures and talked about what y'all were funding in the communities and what the youth were doing. And what I think is really cool is that, you know, we have all these big state level conversations about how we want to support our communities, and then y'all get to do that through your work, and to be able to see that is really amazing because you go full circle. And then Jamie, is the very important work you're doing with empowering youth. Not only are you getting them set up to be our future leaders, but they're obviously leaders of today. They are getting things done that we are trying so hard to get done, but people listen to the youth, right? So you're giving them that voice, and that's so cool. All right, so I was supposed to be sharing my screen, but I got really excited and started talking instead. So let me share my screen. All right, so we do have one more webinar left for this school year. It's on May 15th. Here's our flyer. It's on healthy fundraisers and physical activity for students of all abilities. So we're really excited that we're going to have Kim Kirby, the Skateford Executive Director, talk about their physical activity-based fundraiser that you could bring to your school. So this is great information for now because you can get the information now, think about it, make connections over the summer, and then maybe set up a fundraiser for your school for next school year. And then we'll have Chris Payne talking about adapted physical education and Kelsey Miller talking about Special Olympics with South Carolina. So you can register for that now at wholespire.org. And as always, you can check out all of our webinar recordings on wholespire.org as well, and share those with your friends, your partners, your connections, your networks who haven't been able to make it to a live session. JC, were there any other additional questions while I was wrapping us up?
Just one about how to receive credit for participation in the webinars. We have our survey for the certificate of completion, and then you'll be sending information about CHES, correct?
Yes. So after our last webinar, so after May 15th, shortly after that, I'm going to send, for those who are interested in InCheck, so that's CHES, MCHES certification hours, I will be sending that form out, and it's for all of the spring sessions that we've been providing. So you can take that, you'll have a few weeks to complete it and get it back to me. If you missed a session, but you still want CHES, MCHES credit for it, you can go back and look at the recordings and still do an evaluation. I will be sending that InCheck form out to everyone who's completed an evaluation. So that's how you will receive that form. So there's still time to go watch past webinars from this spring and do the survey and receive the credit after you get the form. Good question. All right. Well, with that, just a big thanks again to all of our friends at Wholespire today. It was so excited to just share all the work that y'all do. And I hope y'all enjoy the rest of your day, and we will see y'all hopefully next month. Thank you.